Hi everyone, my name is Sara and I am one of Dr. Wright's nurses here at the Laser Lipo and Vein Center. And we do a lot of liposuction, so we thought we would do some short videos to give you guys some information that you can look back on through YouTube or on our website in order to kind of refresh your mind on all the information that we talk about at your pre-op appointment, your post-op appointments, and things like that. So Amanda is behind the cameras today and she is going to be asking me some frequently asked questions. So we're going to start off with your pre-op appointment and what is all involved in that.
Okay, Sarah, can you tell us what all happens during a liposuction pre-op visit?
So when you come in for your pre-op appointment, which we generally do about 10 to 14 days prior to your surgery date, sometimes that can be a one-off depending on if you're traveling in from out of town. But at your pre-op appointment, what we're going to do, we're going to go over your history and physical. We're going to go over any current medications that you're on, because there are some medications that inhibit lidocaine metabolism, and if you're on any blood thinners, we need to stop those medications prior to surgery. We're also going to do pre-operative measurements, vital signs, pre-op pictures, go over the procedure itself. We're going to talk about compression and answer any of the questions that you guys have. We're going to also do consents so that you guys are informed on what you guys are going to be doing during your procedure.
Okay, Sarah, why do I need to stop certain medications prior to my liposuction?
So like I just said, there are certain medications that inhibit the metabolism of lidocaine. Lidocaine is one of the main things we use in order to numb you. That's our local anesthetic that we're using. And those medications, have to be stopped several days prior to surgery, as well as there are some blood thinning medications like non-steroidal anti-inflammatories, aspirin, Aleve, ibuprofen, vitamin E, fish oil, things like that that you need to stop prior to surgery to make it safe for you.
What are the medications you're prescribing to me, and why do I need them?
So we are going to send in some prescriptions to your pharmacy for surgery. One is going to be an antibiotic that you will start the day before surgery. We are trying to prevent an infection, not treat an infection, and you will take that for a course of 7 days. We're going to send in a medication for pain for during surgery. We're going to send in a medication for post-operative pain. We're going to send in a medication for anti-nausea. Some people do get a little bit nauseated prior to surgery, during surgery, after surgery, so we want that available to you. And for some people, they may need a blood thinning medication after surgery, so that will also be sent in, but we'll also discuss that at your pre-op appointment.
How long will surgery be?
Most of the surgeries last between 4 to 6 hours. Everybody is different, everybody's surgery is different. Some can last shorter than that, some can last a little bit longer, and it all depends on the size of the area that we're doing, and all the procedures that we're adding into just doing liposuction, if you're having skin tightening, things like that.
What should I expect for the days following my procedure?
So once you leave our office, you will be draining blood-tinged fluid, so you want to make sure that you have some type of barrier on anything that you are going to sit on, lay on, in the car ride home. You're going to be sore, you're going to be tender, you're going to be bruised, you're going to be tired. That's all very normal for this part of the process with your liposuction. It's a very good idea for you to have somebody with you for the first 24 hours because that's generally the worst part of it. You're not going to shower for the first 24 to 48 hours, and when you have somebody with you, at that first shower, you're going to take your time taking off your compression because you can get lightheaded. So just as a safety measure to have somebody with you for this shower.
When should I expect to see results?
Everybody is very different when it comes to that as well. When you leave here, you're going to be swollen. Some people see results on their first post-operative visit, which is generally 2 to 4 days after surgery. Some people, it can take several weeks. Some people, it can take several months for the swelling to go down for us to see those results. But you just have to have patience with the healing process.